This is Angela Glover Blackwell, and I was a member of the Commission to Build a Healthier America. The last year and a half on the Robert Wood Johnson Commission to Build a Healthier America convinced me that as a nation, we're much more tuned in to the possibility of health as being associated with well-being and not just the absence of disease. And that people on both sides of the political aisle, as well as people at the community level and at the business level and researchers, can easily embrace the idea but need a lot of exposure and dialogue to understand how that translates into policy and changes in our lives. So I was particularly struck by the fact that we could quickly reach agreement as a commission that well-being is really what we ought to strive for, but that it took more time, but then we had complete consensus to the idea that for some people, making the healthy choice is much easier than for others. And there are policies that could begin to make for a more even playing field for all Americans to be able to achieve well-being. I was also impressed throughout the commission process with how this notion of health disparities is something that can be addressed through the well-being door and not just the greater access to health care door. Thinking about the ability to be able to eat fresh fruits and vegetables and what that means in terms of having farmers markets and grocery stores in communities, making sure that if we want healthy diets, the schools are responsible for so much of the diets for low-income children who are eligible for free and reduced lunch and breakfast, and that we ought to really be paying attention to making sure we're doing our part to help children make healthy choices, helping people to understand that there are health impacts from so many decisions that we make, where we put roads, how we zone, the relationship of housing to schools, and this notion of health in all policy. When you first hear it, of course the question is, what does that mean? But it doesn't take but so many sentences for people to have that aha moment. And so I think all of those things really suggested to me that we can be a healthier nation if we educate ourselves and open our minds to the policy interventions that will be important for all people to make healthy choices. I really admire the Foundation for having taken on the issue and having had the courage to talk about how we have disparities and gaps in this country in terms of the ability to make healthy choices, and that our policy decisions can help to close those gaps and reduce those disparities. I love that the Foundation took that on.